Welcome to the LIFE programmes here at the Institute for Healthcare Policy and Practice at the University of West of Scotland. The LIFE programmes are going to be launched this year, 2018. And this just really is a short film introducing you to the concept of what they're about and what they're hoping to achieve. The LIFE programmes really aim to create positive cultures in a range of different environments, including housing, health and social care, education and different practice settings. And they're underpinned by a conceptual framework of appreciative inquiry that aims to create relationship-centred practice and evidence-informed practice through caring conversations. And this conceptual framework has been extensively researched and acknowledged both nationally and internationally over the past few years. Major pieces of work have been undertaken here at UWS to help develop that framework. The framework's really quite important to all of the work that we do. I think with the notion of appreciative inquiry, so often we look across health and social care in particular at things that are not going well, creating a culture of blame and focusing in on the negative narrative about how to fix things. With appreciative inquiry, there's a notion of what you focus on grows and expands. And so perhaps if we focus on what's working well, what matters, and why these things matter, and how can we help them to happen more of the time, this is a slightly different, almost countercultural way of approaching the complex issues in health and social care in particular. So LIFE, what does LIFE stand for? It stands for Learning and Innovating from Everyday Excellence. And that title is really quite important to us, particularly the everyday excellence, because it's not necessarily about all the big, sparkly things that happen and go well. It's about some of these really small things that people don't even perhaps have in their consciousness that go well, that we could more readily notice, understand, and help to happen more of the time. So it's learning and innovating from everyday excellence is the name that all our research and development programs now fall under. We've received quite a lot of acknowledgement externally, positive acknowledgement that this is something that people would be quite attracted to. This idea of giving life to something, perhaps giving life to something that already exists. But our job is really to breathe life into that to help it happen more of the time. One of the things that is really important with this work is that a lot of the time people don't necessarily know the things that they are doing well. They're often quite nuanced aspects of practice. And so it's important that we use creative methods to try and tap in to what we call that tacit knowledge, that knowledge that's in there but it's maybe not sayable yet. So a key focus of our work is about developing creative methods to tap into that knowledge, but also to enable the voices of everyone to be heard in co-creating our new future-focused system. The other thing to say is that our LIFE programmes are sitting within the newly established Living Lab at the University of West of Scotland. A Living Lab is a human-centric design whereby it really focuses on experimenting in practice, new ways of working in real life settings, and with all the people who are likely to be involved in that experience, including patients, residents, families, staff, policymakers, perhaps some production companies, all sorts of people involved in the initiative or the innovation. And so the LIFE programmes sit very nicely within this Living Lab at University of West of Scotland. And I suppose just watch this space and see how that develops. And if you'd like to be involved, please get in touch. To just conclude then, the LIFE programmes are about research and development. And they've got a wide scope. They can link to leadership development, to quality improvement, to improvement science, to curriculum development, to a whole range of things. Remembering that the approach is around appreciative inquiry to create relationship-centred practice, evidence-informed practice through caring conversations.